basically is on casters, right? So this thing could wheel around anywhere in the gym. Okay, so it's fully adjustable. So this thing goes up and down. So I don't know if you can see this here, but this elevates, right? So if you have a pretty tall patient who's in a seated position, you can elevate this to get into any position that they need to. This also rotates, Rose. So if you have a patient with some contractures, maybe they really can't get into this position, you can rotate this so this device could be in a very comfortable position for the patient, okay? It's both adult and pediatric, so we are both an adult and pediatric company. So this armrest here is for the adults. So this is where the hand lies in here, okay? Fully adjustable. But this is the pediatric one, so you can see, like this switches off. And I know you guys are adults, but just so you can see the functionality of this, this snaps in here. And then a patient as young as 3 years of age can get into this device and use it just like that.
We actually do a PED service too. We have
you are PEDs.
We have a physical therapist and a new hire OT that are doing PEDs.
Oh, cool. So you guys see that. So this would be, you know, again, useful for both of the patient populations you guys are seeing. So that just goes here. Then I put this back on. This just pops back in. And it's as simple as that. The device is left and right. So it's a universal device. So I don't know if you can see it. You have your 4 fingers here. So these are the sliders. You have your 2 thumbs. So if I'm going to be a left-handed setup, so it'll be these 4 fingers and this one here. Okay. We use magnetic couplers to attach the patient to the device. And if you can see on my fingers here, these are little magnetic couplers with, we call them finger tapes, Rose, but they're basically Band-Aids with holes cut out in them. And that's so we could charge you guys more money for them. But basically that's how we attach the patient to the device. So we take one of these magnets here, and it comes with a set of magnets, and there are different sizes, but you got your small little baby ones here. You got your mediums here. So these are maybe for your small petite females. And then you have the white ones, which is one I'm wearing, are for like, you know, adult size. And then you have the finger tapes, which are here. These are the Band-Aids with holes cut out in them. And these are what they look like. So these would be your one disposable item, right? So this would be what you guys would need. You know, you'll go through these. If you're doing a lot of sessions, you'll go through, you know, several boxes of these probably a year, if not, you know, more than that.
Yeah, so just to tell you, so each box has 500 finger tapes. So, you know, if you're doing a whole hand, 5 fingers, you can do 100 hands with a box.
Yep. So that would be one of your, like a disposable cost and so forth. So basically you put the finger magnets on, all right? It's a fairly simple process to do. It doesn't take but more than 2 minutes. You adjust the height, so you wheel the patient up in their wheelchair or a regular seated chair. You want to lock the casters, right? And basically the idea with this, Rose, is you want to make sure that the patient's got, you know, they're comfortable. You don't want their shoulder elevated. You don't want them out like this. You want it basically comfortable so that the device is underneath them. You know, their shoulders at you know, a nice height. So this seems a little high to me, so I'm going to lower it down. Okay. And I'm going to be positioned, I think, just about like this. So what I'll do is I'll pull up the software. So I'm using our sample patient, John sample. All right. And what'll pull up is your setup screen. So you have, it says range of motion setup. So what I'll do is this, I'm going to attach my fingers to each magnet. Okay. I don't know if you can see that. But my fingers are coupled to each magnet. Okay.
How
All right.
strong are those? Like how much tone could that break?
Yeah, so these have a specific, so the magnetic couplers are designed to pop off if there's a significant amount of resistance. So if you have a patient with tone, which this device is amazing for, you could still put them in the device even if their hand is curled up like this, right? Just as long as you can get them in the device without like significant contractures, tissue shortening. You want to be able to get them in the device. I mean, even if their hand looks something like this. The device has a couple features, which I'll show you, but these magnets have a pretty solid grip. But you could see I could pop my pinky off there if I really tried. So it's designed for safety in mind. I don't know if you could see that, but that's basically what that's for. Okay. So you attach them to each magnetic coupler. You could then set the wrist in here. So what I'll do is attach. Thank you, Missy, my trusted aid here. And I will put that down. Okay. There are some lateral supports here that I can tighten down. So a lot of times patients will like ulnarly or radially deviate. So these little side supports are awesome because they keep that patient in a nice, you know, midline position. Then you have you basically have this here. So this is your support. And your arm will fit right in here like this. And you have these straps that you could put on if you choose to do so. A lot of times I just skip it, but you can put patients in these straps and these will go over there like this. And this is the setup right here. So what you do here then, Rose, is you basically set the range of motion up for each individual finger. So there's my index finger. So what I do is you could do it passively, or I could use the robot to extend my fingers. Many times I just do it passively. So I get the fingers, I get the patient's fingers into maximum extension. Okay. And then I hit the E. So that's the maximum. So the gray area represents their range of motion. And same for the thumb. So I'm extending my thumb. And that's the maximum extension for each of my fingers right there. Okay. Then what I'll do is I'll bring the fingers into flexion. Right. So I'll bring my fingers into flexion and I'll do the same thing with the flexion there. Okay. And even here as well.
And I'd like to add to this. So when you're doing this, it is meant to be done passively. And the reason for that is in addition to the magnets being a safety feature, this is also another safety feature in the sense of, because this is a robot, you don't want the robot moving in a way that would hurt your patient. So when you're setting the passive range of their extension and flexion, you're setting the outer range of what they're capable of doing, and the device will not go beyond that. So it will always stay within that range.
And what's unique about this is too, you can choose the smallest little bit of range or the largest you want. That's the beauty of this device, is that you have the capability to really isolate finger movement, individual finger movement, or, you know, a lot of times you're maybe not interested in these big gross grasp and release movements. You want more fine tuned. So you could literally lock fingers out and, you know, isolate movements that you want to focus on. And that's what makes this device a great tool for, you know, the types of things you guys are trying to do as therapists in your clinic. So each of the individual range of motions are set. You could tell the patient, listen, let's put this through a simulation. Let me hit this button here. So what's going to happen is the device will now flex the fingers. Okay. And now let's say I'll do it again. I want to. So then the device just moves up. So it's very smooth. And it's, you know, again, we try to get patients acclimated to it so they don't, you know, the more calm they are, particularly somebody that might be anxious or getting into technology, we want to make sure that they understand that this is a very smooth, clean, you know, movement.